Ho, ho, ho! Mama's Little Helper coming in today, day 6 of the 12 Days of Christmas, bringing you the gift of information for moms that are postpartum, or maybe you're still pregnant and you want some information to prepare you for that postpartum phase. So I'm Justine Calderwood. I'm a women's health physical therapist as well as a certified birth healing practitioner. Today we're talking about breastfeeding. Okay, so I have my little boppy pillow here, got my little baby. I want to talk to you about ways that physical therapy can help with your breastfeeding experience. So this might be something you've never thought about. Physical therapy for my breasts. In fact, I've seen patients that have said that. I would have never thought, right? So we're sharing information that you just didn't know that people can help you with certain things in your motherhood journey. So I want to talk specifically about 2 different ways that I see women with breastfeeding issues. One is they're actually having issues with the breast themselves, with say pain with latch on. There can be recurrent mastitis or clogged milk ducts. And of course, I actually work with a local lactation consultant, and we collaborate on this as well. But I've educated her on really how physical therapy can help with releasing breast tissue as well as into the chest, the upper back, and what I do is I actually see my patients as a whole person. So if someone comes in and they're having issues with breastfeeding, I'm going to get a complete history of what else might have happened in this area that might be causing some restrictions in the soft tissue that's not allowing that milk to flow, that's causing some recurrent infections or the clogged milk ducts and that. So definitely I take that into consideration. And that was one of the things when we talked, she was like, wow, I had no idea. I want to tell you a quick story. One gal that I saw within days of her having her son, she had tremendous pain upon latch on, and it was causing pain into her back. And I saw her for just a few visits, but what we determined was she actually had birth trauma. And when we released that, her breastfeeding experience just took off. I mean, she was able to then latch on. Now, I do want to say that the child was able to latch on, and she was able to have a really great experience getting started with breastfeeding then. Now, there can be more going on, of course. There can be tongue and lip tie issues with babies. So this really, you want some professionals looking at the situation of whatever's going on. The other thing that I see that moms have, think about how long are you planning on breastfeeding. For some women, it's maybe a short amount of time. For others, it might be years, right? And so the posture and the position that moms go into in order to feed their kiddos takes a toll on the body. So it can be more of a long-term progression of tightness and tension that's going on into the upper back, the neck, causing headaches, pain in the upper back, tightness in the shoulders, that type of stuff. And it can really cause a lot of pain and issues. So today, what I want to share as my gift for you on this day 6 is just a guide on breastfeeding postures, some stretches, some strengthening exercises that you can do if you are starting to already notice that you're getting some tension or tightness, or if you just want to prevent this from occurring, okay? So I want to share that with you. You can grab it from the link in my bio. If you're watching this on Facebook, you can just use the link that we're providing, okay? So yeah, that's what we're sharing today. Let me know if you have any questions, and remember to tag a mom that you know that could really use this information. So bye-bye for now.